Adrenoleukodystrophy. Adrenoleukodystrophy is a rare genetic disorder characterized by the breakdown or loss of myelin and progressive dysfunction of the adrenal gland. Brain function declines as the myelin sheath is stripped from the brain's nerve cells, causing the neurons to lose the ability to tell the central nervous system what to do. ALD affects 1 in 18,000 people, primarily males. It affects the spinal cord, brain, adrenal glands, and testes. The ALD protein helps your body break down very long-chain fatty acids, but this disease inhibits that action, and thus fatty acids are built up in the body. Clinical presentation of ALD can vary greatly, making diagnosis difficult. The concentration of unsaturated very long-chain fatty acids are significantly elevated in males with ALD even before other symptoms develop. You can use gas chromatography mass spectrometry and molecular genetic analysis to confirm ALD. The phenotypes of ALD include the childhood cerebral form, Addison's disease, AMN, the asymptomatic form, and women's form. The childhood cerebral form of ALD represents 45% of all cases. The most common and severe form of ALD, the childhood cerebral form, is characterized by normal development followed by rapid degeneration and occurs between the ages of 4 and 10. Beginning with behavioral problems, symptoms worsen, eventually leading to death or permanent disability within 2 to 5 years of diagnosis. Symptoms of childhood cerebral ALD include muscle spasms and seizures. Addison's disease is the result of permanent injury to the adrenal glands. It can be life-threatening if not recognized quickly. Most ALD patients develop Addison's disease, but not all patients with Addison's disease have ALD. In about 10%, symptoms of Addison's disease include poor appetite, weight loss, decreased muscle mass, and coma, but can often be non-symptomatic. The only treatment for Addison's disease are daily steroid pills. Adrenomyeloneuropathy is when men in their 20s and 30s exhibit neurological-based motor lesions that progress over time and are inevitably accompanied by moderate to severe handicap. Adrenomyeloneuropathy, or more commonly known as AMN, affects walking and balance and has a slower progression than the childhood cerebral form of ALD. There is no treatment. Symptoms of AMN include pain, weakness, urinary problems, and sexual dysfunction. Asymptomatic ALD occurs when people with the ALD gene never develop symptoms. Although women who carry the ALD gene mutation do not generally develop the brain disease itself, some display mild symptoms of the disorder. Symptoms for women's ALD usually develop after age 35 and primarily include stiffness, weakness, pain, and urinary problems. Treatment for ALD includes Lorenzo's oil, bone marrow transplants, and physical therapy. Lorenzo's oil, while not FDA approved, can help decrease the risk of developing the childhood form of ALD. A bone marrow transplant is used to treat early signs of ALD. While the outcome depends on the patient's clinical status, it typically works on 2/3 of patients. Physical therapy is recommended for patients with walking difficulty. Another possible treatment for ALD is a diet low in very long-chain fatty acids. Brought to you in part by Myelin.org, Stop ALD, and Healthline.com.
Created using Powtoon.